Guess who I just connected with, warriors? Leap Cure. Leap what? Leap Cure. Leap Cure connects patients with clinical trials to make research more equitable and efficient. Listen to their latest clinical trial.
If you've been diagnosed with thyroid eye disease and are seeking potential new treatment options, you might be interested in the LIDS clinical trial. If you're 18 and over, have a diagnosis of Graves' disease or Hashimoto's, and are interested in potentially participating in research, you can fill out a short questionnaire at lpcur.com/TED. You'll be connected with someone on the team to determine whether it might be a good fit for you. Check your eligibility and learn more at lpcur.com/TED.
Hello, warriors. Before the interview, I would like to review the subject matter. A subject matter autoimmune warriors know all too well: chronic pain. Chronic pain nearly affects 50 million people in the U.S. alone. A study in the Journal of American Medical Association shows new cases of chronic pain occur even more often than diabetes, hypertension, and depression. Many people are surprised to discover the most effective treatment for chronic pain is a multi-pronged approach. Yeah, it is a self-pain management, and this allows patients to function more effectively. But it takes time to learn the activities and time to practice the skills. That is why I'm happy to introduce my guest, Dr. Afton Hassett. She is Associate Professor and Director of Pain in the Department of Anesthesiology at the University of Michigan. She recently wrote a book called Chronic Pain Reset: 30 Days of Activities, Practices, and Skills to Help You Thrive. The book explores key roles that your brain plays in processing pain and how small, simple actions can make profound changes in how you experience chronic pain. So let's get started. Thank you so much, Dr. Afton Hassett, for joining me on the Stronger Than Autoimmune podcast. You are an associate professor and director of pain and opioid research in the Department of Anesthesiology at the University of Michigan, and you recently wrote a book about 30 strategies for pain management. So before we talk about your book, I would love to understand more of the neuroscience on what is pain. And they say it's only in the brain, but how does that even work? Because I feel it everywhere else except my brain.
Yeah. Isn't that interesting? Well, first of all, Desiree, thank you for having me on your show. I'm delighted to talk to you about my new book, Chronic Pain Reset. A big piece of that is translating the remarkable neuroscience that has been taking place over the last 20 years and writing it in a way that's hopefully really accessible to people who have chronic pain. So that it feels like it's neuroscience explained in a way that it has it has a comfort. You can feel like you're actually learning something because we have learned so much, and this information doesn't get to the people who suffer with chronic pain. And you're right, pain is in the brain, even though we might feel it in our knees or our hips, our joints, our back. But without the brain to process pain, pain doesn't exist. You might think about the case where somebody is under having surgery, and with the anesthesia, the person feels nothing. Because what anesthesia appears to do is not allow the brain networks to adequately communicate. And so the message isn't processed. And then when the patient wakes up, oh boy, everything starts processing again and the pain is felt. So, yes, pain is in the place where it occurs, meaning that if you have a knee that's been injured, the little receptors in the knee are saying, ow, there's pain here, and it sends the message up to the brain and it's processed. But what we've learned that's so fascinating is in many people with chronic pain, there's no longer even a need often for the knee or the back to send that message. The brain actually has overlearned that message and is sending that message or amplifying that message really without much feedback from the injured knee. So a knee injury that may have taken place 3 years ago that was maybe replaced, but you got a knee replacement, pain can still be coming from that area, even though the affected part has been removed because the brain has learned
Oh,
that pain and it is still processing it. We think about the case of phantom limb pain, which most people have
yeah,
heard
that's what I
about.
was thinking about. Yeah.
Yes, exactly right. So the leg, as it might be, has been removed, but in the brain, it's like my foot is hurting. You hear this from people who have lost limbs. They don't know how and can't explain it, but they are still feeling pain in that limb that is gone. It's because these networks have so learned that pain message. It just exists in there. And with people who have chronic low back pain and people with fibromyalgia and a number of other conditions, a subset of them actually have pain that's amplified. So that you might be getting some feedback, a little scrunching of the knee or a muscle twist or a little impingement of back, but that signal is being amplified. So instead of feeling like ow, it's like ow.
Yeah.
A very big difference.
Yeah, that is quite amazing how the brain it's creating these pathways. That's what you
Mhm.
and it once it created this highway or pathway, it's hard
Yeah.
to break it. That's what you're
Yes.
essentially saying.
Exactly.
So, what are the factors that play into creating these pathways or highways?
Hmm. Yeah. So we think genetics are a really important piece of it, that some people are more likely or potentially just predisposed to be pain sensitive. And so their wiring is such. And so we see a lot of chronic pain in families, like we see a lot of autoimmune disease. So there's these genetic components kind of within families. But we also feel like the environment plays a really important role. So if somebody is under a lot of stress or has a lot of negative emotion, that can amplify the experience of pain. Even when people think, if you think really negative thoughts, it amplifies pain. So that doesn't mean that pain is in somebody's mind, they're making it up. It just means that our brain processes emotions and thoughts and pain using many of the same areas and the same network circuitry. So if you think something really stressful and frightening after you've just twisted an ankle, usually that ankle is going to hurt a lot worse than if you sit back and laugh because you feel like such a goof because you tripped in front of a bunch of your friends and they're all laughing too. That might hurt a lot less, maybe until later, but just, at that moment, all of these emotions, thoughts, and our environment have a lot of input to how that pain is actually perceived. Again, it's not about making up pain or having pain in your head because, something that you're doing. It's just as how information is processed.
So, positive emotions. So, if I'm going through a really happy time, like
Yeah.
I'm giving childbirth and I'm really happy
Mm.
about that,
Yeah.
you're saying that it's going to be less pain.
Yeah.
Or if somebody with fibromyalgia and they are having a stressful day, but then they're having the same pain, but later on it's their birthday and they don't
Yeah.
feel it as much. Okay, so that's what you're saying.
Yeah. Oh, that's right. That's right. And it can happen really quickly too. Somebody can be having just an incredible experience of pain and then just get really engaged in a hobby or something they love to do. And they get that feeling of flow. This is kind of a positive psychology notion that we can get in these spaces where we're so engaged and so mindfully, kind of joyfully doing something, that everything else fades to the background. In that case, the pain can actually almost disappear for that moment because all the attention and flow have moved into this positive, all encompassing activity.
Yeah. And so how do memories come into play? Because you're in the moment, right? You're
Mm.
talking about that I forgot it's a long name, Servinsky or about flow, the book. I forgot his
Oh,
name.
yeah.
Yeah.
Yeah, we call him Mike, but it's Mike Csikszentmihalyi.
Yes. Yes. Thank you. I could not remember. Um,
Yeah.
but so you're in the moment, the pain will lessen, but how does memories come into play when you're you're in bed, you don't feel good, you don't feel like doing your hobby, you don't feel like doing anything. How do memories come into
Mhm.
play with this?
Oh, that's so interesting because if it's a good memory, if you're able to just sit there and get kind of mindful and peaceful for a moment, and just let yourself fall into a memory, like you mentioned childbirth. For many, that's like the happiest moment. Actually, after it's over, ideally, but that's a beautiful moment. And when people are able to kind of submerge themselves in that type of memory, often that can help distract or help pull away from the pain. Because again, you're sparking positive emotions, and positive emotions tend to help spare the experience of pain. Again, it's just different parts of the brain are activated when we, and then if we have a memory that's very frightening and troubling, if we're kind of laying in bed and we're in pain and we're ruminating about something that was terrible that was done to us, and how bad we feel about having done something ourselves and we feel guilty, that can make the pain worse. Again, these emotional and thought states are really powerful. And then for other folks, memories can get in the way of moving forward. So if your memory is about the accident that initiated the chronic pain, and you're thinking about perhaps there's a car accident and you were injured in it, and you're thinking about that over and over again, that can actually make the pain a lot worse. Whereas the memories where you're on a vacation and you're remembering eating a wonderful meal with a great friend and it's so special, that can help ameliorate the pain. Again, it helps deactivate the stress levels, and that has a lot to do with how we experience our pain.
And a lot of your research and your time and effort have gone into how to break these cycles.
Yeah.
How how did you measure this, or how did you work with people doing this? This is amazing.
Yeah. So, so much of what I talk about in the book is really the culmination of not just my research, but so much fascinating research from around the world looking at pain and behavioral treatments for pain. And so we hear often from patients, I don't want to try another medication. Really,
Yeah,
is there
yeah.
something else? I'm on 6 medications. I hate them all, and I'm still in pain. And so there is this whole other view of what that can be done to also decrease pain that is not by taking a medicine, because actually medications mostly mask pain. They don't necessarily go at the cause of pain. And of course, if you have an inflammatory condition like an autoimmune disease, yes, your medications are probably the best thing you do for pain because they are decreasing the inflammation. That's probably part of the pain. But for many people who have other types of pain, like what we call nosoplastic pain, which is pain that's mostly driven by the brain, so many other things are more beneficial. Probably one of the best things is just moving, is getting a little bit of exercise, not going to the gym necessarily, but just getting out and walking in nature, getting out, changing the stimuli around you to something that's more pleasant, having a little exercise, sleeping a little bit better is probably one of the best things that we can do. It's so powerful to help with our pain. So regarding sleep and exercise, our team have done studies where we've taken totally healthy volunteers who like to exercise and typically sleep well and deprived them of both. Made it so they could not get their exercise anymore and regularly disturbed their sleep so they couldn't get any good continuous sleep. And they developed within a relatively short pain something that looked a lot like fibromyalgia. They were achy and fatigued and couldn't think and poor mood. And so then just allowing them to exercise and get sleeping again, the symptoms got better. So we can even do this in healthy people. So exercise and sleep. And then kind of the other piece is just what you do. So by engaging in things that bring you more happiness, that can go a long way to helping you, not even a more rewarding life, but to decrease the actual experience of pain. Because again, positive emotions help offset some of these pain signals and actually begin to rewire your brain. So the more that you start doing some positive activities, things that, exercise, getting back to the habits that you enjoy, spending more time with friends, getting off of the sofa, out of bed, just kind of moving again. Again, that allows you creating more connections. Maybe study a new language, maybe pick up some an artwork or craft that you've always wanted to do. Again, it's challenging your brain with other types of stimuli.
Kind of like almost distracting it in a way.
Yeah, it's distracting you, but it's also building brand new connections. So you can either kind of reinforce existing connections by being stressed, by not exercising, by continuing to have poor sleep, by being incredibly negative and withdrawn and feeling alone in your life. And those really reinforce those bad connections or do the opposite. And that
Yeah.
starts to build the new connections and it weakens the old ones.
And thank you for explaining all that. That really, you're building these, you're constructing a different way
Yeah.
of connecting your brain and associating
Yeah.
things so you can build a new highway, new pathway.
Hmm.
Okay.
Yes. Yeah.
And I'm wondering, how does hypnosis come into? Is that another strategy that can
Mm.
work for pain distraction?
Yes, I think hypnosis is fascinating. And again, we don't fully understand exactly what it does, but it appears to kind of disrupt some of those networks, kind of some of the connectivity. So you kind of there's two networks that we think are probably most active in pain. One is called the default mode network, and that's the network that's kind of active when we're hanging around and we're thinking about what we're going to eat for lunch, and we're thinking about, oh, does my back itch, and we're kind of daydreaming. That kind of runs. But there's also this other network called the salience network, and that's a network that's looking for important stuff. Is there a threat out there? What am I experiencing? So we those two networks appear to be overconnected in chronic pain. And
Oh,
so, it's just kind of like, oh, I'm kind of thinking about my body, what's going on. Oh my God, there's threat. And so, and so it just kind of creates this really difficult environment where hypnosis appears potentially to maybe let loosen those connections. And that's what we often see with behavioral therapy. So if somebody, undergoes like physical therapy for a while, or they do a mindfulness training, or, even cognitive behavioral therapy, those are the networks that seem to loosen when somebody
okay.
has a good response to treatment. I'm not probably saying that the most scientifically, but in a way that hopefully creates kind of a mental picture of what's going on.
No, I love that. Thank you so much. I'm just truly enjoying how you're explaining everything. You're bringing it down to my level because I know you could use much bigger words.
Not necessary.
And I know you also talked about the relationship between pain and resilience.
Yeah.
How do you build this? Or, I mean, what is the connection?
I love that you asked me that, because that really is the thing that I've grown to love most about the research that I do, is not just focusing on everything that goes wrong with people. I'm a pain psychologist, and so really our training is, okay, how does depression fit in here? How does anxiety fit in here? How does pain catastrophizing fit in here? And that was the work I was doing early on, until I discovered that that's only one small piece of the story. That there's always this large subset of people with chronic pain who are not depressed or anxious and never have been, and who are really just ridiculously resilient, and they don't catastrophize. And so I love learning about those people, and that's really what I've been. It's what are they doing? How does this work, and how do we teach others? And so that really is kind of the impetus for the book. What have we learned about resilient people with chronic pain, or resilient people in general, and how do we give those tools to everybody? And
Hmm.
many of the 30 days of activity, skills, and practices are some are geared for chronic pain specifically. How do you lessen your pain? What are tried and true things that are evidence based that can help people decrease their pain? But many of them are just living life skills that are appropriate for just about anybody. I've talked to people already who are using the book with their spouse that doesn't have chronic pain, but it's like, no, you need to work on your mood, or getting, you're too stressed out. You need to learn some of these things too. So these are just great evidence-based tools. And the way that we've set it up in the book is that different things resonate with different people. And all we wanted to do with this book is just give people 30 really cool things. And each day you open up and you learn about one of them, and you try it that day. And at the end of the day, you think, you know what? I kind of like this skill. This is something I want to build and learn about. Or you think about it and you come back at the end of the day and say, no, this was really silly. This makes no sense to me in my pain. It does not fit in my model of and I'm not going to do it. Fine. The goal is at the end of 30 days, you've tried 30 different practices and skills, and you've identified maybe 5 maybe 10, some people say 20, but you've identified some of them that you feel like might be helpful and that you're actually maybe excited to do, that feel like, oh my gosh, this feels like it might be a new way to kind of even jumpstart my life a little bit.
Yeah.
And that at the end of the book, we just kind of think about how do you put these into practice? How do you actually now take these cool things and make them work for you?
Yeah. Fit them into your life. And that's what
Yeah.
I read a brief summary about your book, and that's wonderful that you have 30 different ways. I mean, even
Yeah.
if one way works, you're
Yeah.
still decreasing the pain. So,
Yeah.
but I'm sure
I love
you'll,
that you said that.
yeah. And I'm sure there's going to be more than one, but like I just said, even if one is
Mhm.
calling your name and like, I
Yeah.
could fit this in my life, it's going to help. Um,
Yeah.
and I know there's another part of this. You talked about chronic pain
Yeah.
and manifestation and mediation symptoms. Can you kind of briefly talk about what that means?
Are you referring to the other symptoms that come along with chronic pain?
Yeah, yeah,
Yeah. So, we talk about how disruptive chronic pain is to people's lives. And frequently, and I learned this really firsthand when I was doing a study with people with lupus. And we were really interested in how having an illness that has many skin manifestations, how that would impact their self image and body image. And so we conducted these really fascinating interviews with a lot of individuals with lupus. And one of the things that we learned, one of the offshoots, was that they told us that, yeah, pain is a drag. We don't like that. But what really is wiping us out is fatigue.
yeah,
Fatigue is the worst part of this illness. And we heard it over and over again. I was like, wow, that's really a great point. It's not always about pain. And then years later, we worked with a number of, just people in oncology and in dentistry and all these different fields. And we saw this pattern across all these patients from gastroenterology, I mean, every field, that it's not just pain, there is this cluster of symptoms. And this cluster of symptoms, um, it kind of explain why people feel so bad. And so we spend a lot of time thinking about, it's sleep is one of the important symptoms, pain, affect our emotions, cognition, or energy or fatigue. And what that spells is space. So we call them our space symptoms. And if you have one of them, you probably have others. And what is so fascinating about pain is that sometimes you can decrease the pain by working on one of the other symptoms. We call it a sneak attack. So, one sneak attack to decrease pain is to get people sleeping well again. Because once you start sleeping better, your pain goes down. And once you start sleeping better, if you have poor mood, anxiety, or depression, that tends to get better too. Then, as your pain gets better, often your cognition gets better. It starts to clear. As you're sleeping, your cognition gets better. And as you sleep, you tend to get more energy. So, they all kind of play into each other. So, these space symptoms are different for everybody. And so, one of the things we do in the book is have people account for, which symptoms bother them the most, and is there a way we can strategize to have a sneak attack, by doing one of the symptoms that we can wipe out the rest.
awesome. And that is true. I mean, if you get good sleep, everything seems so much better. It, you are more clear-headed, you do have more energy, but it's learning those ways of how to sleep. Thank you
Yes.
for talking about how all these other symptoms come into play. It's not just one thing. And also, from my understanding, you done a lot of work with the brain, and I didn't know this, that when you have chronic pain, it changes the length of your telomeres. Yeah, I found
That's
that fascinating.
that's cool. Oh, that's cool. I'm glad you brought that up. This is just some really interesting work that we're doing with Alyssa Epple and Eric Prather at University of California at San Francisco. They're really the leaders in the field, and it was just delightful to do a little work with them. But the telomeres are, they're kind of like little caps at the end of your DNA. And so every time, a cell splits, a little bit of DNA gets lost, but the telomeres kind of help decrease the, that likelihood that that's going to happen. But what every time it does, that you do lose a little bit of the telomere, it kind of comes off. And so we can look at a cell's age and kind of get a sense of, kind of what is the biological age of an individual by the length of telomeres. So children tend to have very long telomeres at the end of their chromosomes, of their DNA, and then older adults tend to have shorter ones. But what we see is that things like stress and illness and depression and disease all tend to shorten our telomeres prematurely, which really is kind of a sign of cellular aging. And what we discovered, what we saw in chronic pain, and we're not alone, others have shown this too, that the people who have more severe pain, and if you add on depression on top of that, they actually have biological aging that puts them probably 7 to 8 years older than they should be, right?
Mm-hmm.
So our bodies pay a price for pain and for stress. And that's just kind of one of the manifestations. But what's so cool about telomeres is that some of this is reversible. So
Really?
there is an enzyme called telomerase, which is actually what is there to help telomeres stay preserved. That can be increased. The telomerase activity that preserves the telomeres can be increased by exercise, healthy diet, meditation, mindfulness, positive emotions. All of these appear to be sparing. They can help actually kind of slow down the process. So though you may be very, very stressed, if you add on positive emotions and positive experiences and positive relationships, you actually can start potentially changing how your physiology is responding to the world. And there's a lot of data that tell us that positive emotions are related to just about everything positive that we want: lower blood pressure, less inflammation, better diabetes outcomes, etc. So it's amazing.
Yeah. And that plays into what your resilience part that you're so
Yeah,
fascinated with. Like, how do some people have these illnesses and they do really well and
yeah,
others don't? So it
yeah.
really is playing into these positive things in life that people should be doing all the time. And I'm wondering, what got you fascinated? I mean, I guess I should have started off with this question. What got you fascinated with pain? I mean, I think everybody goes into a specialty or into a career because they're passionate about it. So how did that passion start with pain?
I got here quite accidentally. I was actually, I was a trainee working on my doctorate, and I was working at this really interesting center in California that was an outpatient center for people with some pretty significant psychiatric illnesses. And I was just going to be like a plain old normal psychologist and just do clinical, no, not just, but do clinical work. And I had no interest in research at the time. And I was working with these really lovely women who had a lot of depression and anxiety, but they also had chronic pain. And it was such a challenge that every time I felt like we were making psychological progress in our sessions, their pain would get so much worse. I was like, what is this? Why is this happening? And my lovely supervisor said, you know what? Go to the UCSD, University of California, San Diego library, go to the medical library there and look up fibromyalgia and chronic low back pain and look at what's the intersection? What do we understand about the neuropathophysiology of pain? And I went there and I found some incredible articles that really made it clear about the biological connections between our emotions, our behaviors, and our experience of pain. It's incredible that it's all one. And it's always how I kind of felt, that we are all one unified process, the true biopsychosocial concept of pain. But those early articles made it so clear to me. And at that moment, I went back to my supervisor and I said, this is what I want to do. I want to do research. I want to do pain. And she's like, okay, good. Welcome to the group. I knew this would be good for you.
Yeah,
And
I
that's
knew
how
there
I
was.
got here.
Yeah, no, I knew there was a story behind it. There had to have been. That's amazing. Yeah. So I'm wondering, so those women did have fibromyalgia?
Yes, many had
Okay.
fibromyalgia, and it was so interesting. And and then I could use that to help them. help them, prepare that, as we do hard things, you might be more stressed, it might disrupt your sleep, and your pain might get worse, but it'll be okay. That's part of the process. And so it
Mm.
just made it easier to work with them going on to understand the interconnectivity.
Yeah. So it's almost like you were trying to build their resilience, yeah, it'd be
Yes.
stressful and they want to go backwards, but you're saying kind of help them push through,
Yeah.
sounds
So we
like.
can get to the other side of this. Yeah.
Yeah. Okay. And I also found it fascinating when I was reading up on you that you are helping create programs instead of rehab, you're creating
Mm.
prehabilitation
Yeah.
for surgeries. Tell me more about
Yeah.
that, or tell the
Oh,
audience
I'm,
more
I'm
about
glad.
that.
I know. I'm so glad you asked that. This is some of the most exciting research I think we're doing. So there's a lot of interest in how do we spare people who have acute pain from going on to have chronic pain. We know many people with chronic pain had some sort of incident in their life that started the pain, be it autoimmune disease, be it a car accident, be it some sort of crime or a victim, victimization of some sort of trauma. Something usually happens before. And one of the things that can set chronic pain in motion, we found, is surgery. So I'm in the Department of Anesthesiology at the University of Michigan in a really wonderful position where I can work in the perioperative setting too, work with physicians and surgeons and anesthesiologists, and to better understand, who goes on to have chronic pain. So one of the biggest studies that we've conducted on that I'm a co-investigator on is understanding what are these factors in people who have surgery to go and go and develop chronic pain after that. So we've learned, what these are, and often it's having chronic pain before the surgery. That's a big one, of course. Having kind of a fibromyalgia-like presentation, just meaning that you have a lot of widespread body pain coming in, as one of the best predictors. But what we're also interested in then, okay, we understand what makes it worse. How do we spare people? And so I've been working with another lovely hand surgeon, Jen Walge, and my colleague anesthesiologist, Chad Brummett, and my mentor, Dan Claw, and we've developed an app to be used in the perioperative setting. So we, at the University of Michigan, we often have 2 to 3 weeks before a person finds out they're going to have an elective surgery, and they actually go in, and they often come to a pre-op clinic where we can talk to them. And what we found is that if we give them this app, that first of all gives education, and it just tells people the most important elements is that surgery is painful and it's meant to be painful, because you don't want to be jumping around with a big incision, right? So that pain is good. Okay, so a little pain is
Yeah, it's
fine.
telling you to slow
um,
down.
yeah, slow down. That's all right. Pain serves a purpose. Pain was, invented to be a useful thing. People who don't have pain receptors don't live long, right? But also, what we do want to do is also give you tools that you can decrease the pain post surgically too, and decrease anxiety leading up to it. So, by teaching people some breathing techniques, doing some visualizations, doing kind of a hypnotherapy, kind of kind of hypnotic suggestion by listening to guided imagery, just to kind of help people kind of recenter. And what we found is we can very effectively decrease um, anxiety going into surgery, greatly decrease it. And people are like, okay, I kind of feel pretty good. I feel like I got some tools here to do this. And we greatly decrease the experience of pain after surgery and even opioid use. Most of the participants that actually use the app didn't need opioids very long after surgery. Almost all of them went off compared to almost all the other patients who continued on. It's just like they thought, oh, I'm supposed to have some pain. That's cool. I can just take acetaminophen, and I can do my breathing, or I can do my visualizations. So it was really incredibly empowering. So we're actually hoping to get a large grant to do a full trial on this, because it's, I think, something that can be so useful. So if we can prevent
Absolutely.
chronic pain, that's great.
Yeah, that's amazing. I mean, I just thought about this. My husband, he, I mean, I guess he's opposite me because I have fibromyalgia. So,
Yeah,
and he, I mean, he has a high tolerance to pain. So,
yeah,
how does that work? I mean, people that have a high tolerance to pain, I mean, I know he doesn't do imagery. So, I
no,
mean,
no,
have you done
yeah,
any work or studies on
oh
that
yeah,
of how that works? How do people have
yeah.
high tolerance to pain?
Yeah, that's so interesting because we all have different kind of tolerances. So we think about it as a bell-shaped curve, right? You might remember from algebra, you have the bell-shaped curve, and all of us are kind of in the middle there, or most of the people are in the middle. But there's people to one side that, in the case of pain, are really pain tolerant. And your husband might be at the bottom, this tail end of the bell-shaped curve, whereas most of the people with fibromyalgia are on this other tail end. They're very sensitive, but they also tend to be very sensitive to a lot of things, to
Mm.
light, scent, smells, medications. It's just kind of how you're wired, so to speak. And so we do understand that you guys are just different creatures, right? It's just how we are biologically set up. And I'm sure there's other kind of biological differences, many between the two of you. But yeah, we do understand that. It's just years and years of understanding of where we all land on this curve. So, but we all have different kind of pain tolerance. Like I'm on the tolerant side, but when something is painful, it's so painful. It's like that is it. So
Yeah.
we all have these different ways that we're kind of set up and wired. And if you understand that, that can be really quite helpful.
So and I think this is a great segue of going
Mhm.
more into your book. I know we know it's called Chronic Reset or Chronic Pain Reset.
Mhm.
And what are some strategies? Because you said not only people can use it for pain, but people
Yeah.
can use it, like you said, husbands or, for stress. What
Yeah.
strategies do you personally use
Hmm.
or do you want to share?
Yes. So there's a couple of things. So like a great example of one for pain is what we call activity pacing by time. And what that is you do an activity, say, for example, it might be, it's a great time of year for this, raking leaves. Okay. So you can go out there and you can rake leaves for 10 minutes without wiping yourself out, without inducing a pain flare, right? You can do that. It's going to take way longer than 10 minutes. And so what people tend to do is they just push through and they do all 40 minutes
Mm,
of raking and then they are paying for it for 2 days afterwards. Well, time-based pacing says, hey, you can rake leaves for 10 minutes. Do it for 10 minutes and then take a 5-minute break, a 3-minute break, a 2-minute break. Just take a break, stretch for a second, sit down, and then do another 10 minutes. Never allow pain to be your guide, right? Because as soon as you make, okay, I'm in too much pain, I can't go for it. Now you've induced a flare. You're probably in bad shape. So you learn these pacing regimens for all different activities, right? So you can rake for 10 minutes, stop for 2 minutes, rake for 10 minutes, stop for 2 minutes, rake for 10 minutes, stop for 2 minutes. And you'll probably get through the activity without inducing a flare. So that's a great skill. A skill for everybody is mindful breathing, something that I do that's really helpful. And to me, this is my kryptonite against sleepless nights. So what mindful breathing is just as simple as becoming aware of your breath and trying to think about nothing else. And so what you do is you just get very settled and you just become aware of breathing in and breathing out. And that's simple. So every second, something's going to try and pop into your head because it's how we work.
yeah.
And you just dismiss it. That's fine. Let it go and come back to your breath. And over again, every time somebody tries to, jump in, just kind of go back to your breath and you can count breaths or you can just be aware of them. Feel what the air feels like going in and going out. And every time the thought comes in, gently dismiss it and go back to your breath. And this is just a really great way. It's really kind of the core of mindfulness. It's just this notion that we can become very still, we can become very focused, and that even the world's best meditators still have stuff that jumps in every few seconds, right? It's just us as humans, but the better we get at allowing it just to dissipate and just not judging ourselves, allowing these things to pop in and allowing them to go out. It's incredibly powerful. So that's a really important thing. And another thing that I really love is gratitude journaling.
Mm,
So that's just as simple as every day taking stock of life because what we tend to do is focus on everything that went wrong. And it's often what we'll do. We'll come home after a long day and just complain about all the bad things that happen. It's how we're wired as humans. We look for threat, we look for the negative. We have to be intentional about inviting more positive into our life. So gratitude journaling just has you at the end of the day thinking about the things that happened out the day and the things that you're grateful for. And it can be something really big, like you're so grateful for your uncle's health. Perhaps he was sick and he's doing well. Or it can be something tiny. You're so grateful for a chocolate chip cookie that was really gooey and fabulous that you just had, right? So just taking stock of these things, just maybe writing down 3 of them every day and try and write down different things every day. And it'll make you much more aware of the positive things in your life.
Yeah. Well, thank you for sharing all that. And thank you for sharing
Yeah.
your favorite or the one that works for
Yes.
you. And is there anything that you think you would like to share or add to the conversation? Something that I haven't asked, maybe?
Yeah. Oh, thank you. You're so sweet, Desiree. I think what happens is this is probably longer than a few minutes, but one of the failings of kind of Western medicine is that we've gotten so into the habit of you go to the doctor, they give you something, you go away. And whereas there's this really big evolution is happening now where we're wanting to become more active agents in our healthcare. And physicians are coming to this too. They're realizing, especially for chronic disease management, heart disease, diabetes, chronic pain, that it works so much better when we empower ourselves as humans and take more responsibility for health, but actually know that the healing is kind of already in us. Really truly knowing that there are things that we have power. We don't have to keep waiting for the pill to come along. We don't have to keep waiting for the magical surgery to come along because we are wasting time. We can start to lead our lives today just by taking, taking our health by our own hands. And we can't necessarily make the pain go away, but we do have the power to make our day a little better. And by doing that, we're starting to take a little more charge of our healing. If it's getting out and having a walk, or just sit, even on the worst days, if you just sit outside in nature, there are days that they just say just being in the wind, being in green spaces is good for your health, is helpful. Our humans in our lives by making sure we spend more time with the people who are supportive and loving and nurturing to us, bringing these people closer to us because our social relationships are one of the most powerful predictors of health, including survival. Just having, feeling connected to people and feeling integrated and supported is incredibly important for health. So again, something you can do even a day you feel terrible, reach out to somebody you really care about and just secure that relationship one more nip if you can. Just one more little nudge of kindness for that person.
Yeah, I heard that, yeah, I mean, with people that live over 100, that it's not
Yeah,
just the way they live, but they are
yeah,
connected. They're always doing
yes,
something together.
yeah,
And I think that's what community and being a human is really about.
yeah,
It's having that community and knowing that you're not alone.
yeah. And I think one of the real sins of chronic pain is that it tends to be isolating. And
Yes.
so it just puts it on the person to have to do this, but it's worth it, doing that extra little bit of reaching out and building these social communities and even finding others with chronic pain to connect with can be really powerful. So it just feels good to know you're not.
Yeah, absolutely. I think that's why there's so many support groups going with
Yes,
each illness because you
yes,
feel like somebody, you connect with somebody.
yeah.
Yeah,
Somebody understands.
exactly. Thank you so much for joining me on the Stronger Than Autoimmune podcast, and I look forward to reading your book. Do you have your book you can show with you right now? Yeah,
I do.
there you
This is
go.
probably backwards.
No, no,
It's
no.
available.
Yeah, yeah.
It's available on Amazon and AftonHassett.com. We've got all the other outlets, including links to indie bookstores, so you can support indie bookstores, which I love. So yeah,
Yes.
please read it, and please feel free to email me. I'd love to hear what works and what people are, don't like or enjoy. It's always great to get feedback from the readers.
Thank you. Thank you for extending that invitation. And it's very helpful to know that there's people out there that understand the research and can put it into a simplified book and way to use it in everybody's lives.
Well, thank you,
Thank,
Desiree. It's just been a treat
thank you.
speaking with you. Thank you so much for your interest in the book and in our work.
I hope you enjoyed the episode. As an autoimmune coach, I know what you track on a daily basis makes a big contribution to your symptoms and flares. If you're interested in a free tracking app, go to Isla Health. And like you, I've been hearing a lot about the health benefits of mushrooms lately, but don't care too much for the mushroom coffee. That's why I started taking BioVale Myco from Adapt Naturals. It's a blend of 8 mushrooms, including reishi, chaga, lion's mane, cordyceps, in a convenient capsule form. I get the benefits of mushrooms: more energy, sharper focus, and stronger immunity without having to give up my delicious Java. For a limited time, the folks at Adopt Naturals are offering my audience 15% off their first order. So just go ahead to adaptnaturals.com/DEZ15 to learn more and get started. Until then, stay stronger than autoimmune.